How do you integrate non-pharmacologic interventions like exercise, physical therapy, or patient education into disease management?
So, exercise and physical therapy are really part of the treatment. So, it's just as important as medication. And we really encourage people to do something with a lot of range of motion. So, swimming and yoga, there's really the most evidence for. But there's a lot of other exercises as well that are really part of the treatment for this. And I would say, certainly in my practice, I have several master swimmers, I have several yoga teachers, and those are the people who I find really do the best with this long term. So that is really part of conventional treatment is exercise and physical therapy, and that really needs to be lifelong. I would also say that, in the world of integrative medicine and in functional medicine, there are other modalities that we look at to help relieve pain. And some of those might be supplements, some of those could be dietary changes, and those are generally very useful. I think the caveat is that none of those types of treatments are disease modifying. So they are adjunctive treatments, they are not instead of medical treatments. And unfortunately, I can say that I've seen several patients who for very valid reasons, did not want to pursue conventional treatment and sought to control their symptoms solely with diet and supplements. And while they did feel better, x-raying and doing MRIs later did reveal that the disease did progress and it was somewhat masked by these treatments. So I really encourage people that if they want to seek alternative type treatments, that they can be very useful, but they're not a substitute for conventional treatment and that these things need to be integrated together.
Mm. And what are your thoughts on patients that have overlapping extra-articular manifestations like uveitis, psoriasis, IBD? How do you coordinate care and treatment selection across specialties in these cases?
Yeah, so very often our patients will have uveitis or psoriasis or hidradenitis suppurativa, Crohn's disease. All these things exist on a continuum together. And when we're picking a treatment, we really try to pick a treatment that will cover more than one entity. So, Humira or adalimumab would be a good choice for someone who also has hidradenitis suppurativa or who also has Crohn's disease. An IL-17A inhibitor would not be a good choice in someone who also has inflammatory disease or possibly uveitis. So when we're making a treatment selection, we really try to look at the whole patient and the other types of manifestations that they have along this spectrum. And we try to choose a treatment that will cover more than one.